Hi everyone, in this video, we will explain to you what is leprosy and anti-leprosy drugs. Let's get right into it. Leprosy is a chronic infectious disease brought on by the slow-growing mycobacterium Leprae bacteria. Leprosy targets the skin, the peripheral nerves, mucosa of the upper respiratory tract, and the eyes. Apart from the physical deformity, people affected by leprosy also face stigmatization and discrimination. The bacteria involved, Mycobacterium leprae, grows very slowly and it can take up to 20 years to grow. It is an aerobic, rod-shaped, gram-positive bacterium. It attacks the nerves, causing swelling beneath the skin. The invading bacterium readily causes a variety of skin problems, loss of sensation, and paralysis of the hands and feet. The pathophysiology of leprosy can be categorized into two groups, namely tuberculoid or paucibacillary leprosy and lepromatous or multibacillary leprosy. Mycobacterium leprae enters through the nose and goes straight away to the respiratory tract. It then attacks the nerves and skin. The bacilli move to the Schwann cells of nerves in colder environments, for example, the trunks of the limbs and the face, peripheral, and cutaneous nerves. Then the bacilli within Schwann cells proliferate. This invasion triggers the immunological response. In patients with good immunity that have strong cell-mediated immunity response, histiocytes or macrophages develop into epithelioid cells. These cells engulf Mycobacterium leprae, which causes the infection to stop with the formation of granulomas. As a result, no skin or nerve lesions appear or they appear with healing. This type of leprosy infection is the outcome of paucibacillary leprosy. In a paucibacillary leprosy case, the patient exhibits 1 to 5 skin lesions without demonstrated presence of bacilli in a skin smear. On the contrary, in individuals with strong immunity but a feeble cell-mediated immune response, histiocytes or macrophages evolve into Mycobacterium leprae. The systemic circulation will become infected, which causes lesions on the skin or nerves. In addition, the vascular endothelium, testicles, kidneys, eyes, and smooth muscles are also impacted. This infection results in Mycobacterium leprosy. The Mycobacterium leprosy case is a case with more than 5 skin lesions and with nerve involvement, for instance, pure neuritis, or with the demonstrated presence of bacilli in a slit skin smear, irrespective of the number of skin lesions. Leprosy is an infectious disease that requires multiple modes of transmission to infect another person from the infected patient. The easiest mode is through droplet nuclei. A person who has leprosy can spread infectious airborne particles known as droplet nuclei through coughing or sneezing, which can subsequently enter another person's respiratory system by inhalation. An alternative mode of transmission involves surface contact, whereby those who are vulnerable are exposed to bacteria from skin lesions and nasal secretions of infected patients due to skin abrasions. Leprosy can also be transmitted through the placenta and breast milk, which affects the child. Patients who suffer from leprosy infection will exhibit distinct symptoms on the body surface. They will be unable to close their eye completely. The front of the eye is cooler than the rest of the body, so it is a perfect place for Mycobacterium leprae to multiply. A visible physical manifestation like weakness in fingers or blisters on palms may occur. This will inevitably lead to low self-confidence in their body image. Red swollen patches may develop on large areas of the body surface. These patches are accompanied by sensory loss, which can be explained by the inflammation of infected fibers, also interferes with the conduction of both sensory and motor impulses in adjacent non-infected fibers, innervating non-inflamed skins and muscle. Leprosy also produces repeated blisters or ulcers on the soles of the feet. Anti-leprosy drugs. The treatment to leprosy infection is the administration of anti-leprosy drugs. The objective of the treatment is to possess antimicrobial properties and work by inhibiting the growth of the bacteria. A recommended example is dapsone. Its mechanism of action involves the action of inhibiting folic acid synthesis and is bacteriostatic in nature. Its adverse reactions range from moderate to severe, which include hemolysis, gastrointestinal disturbances such as nausea, vomiting, and abdominal pain, and also hepatitis. An alternative agent to dapsone is clofazimine. The mechanism of action is by binding to bacteria DNA and preventing it from DNA replication, which explains its bactericidal properties. It is used in combination with rifampicin and dapsone. Clofazimine produces adverse reactions like red-brown discoloration of the skin and eosinophilic gastroenteritis, which is an uncommon gastrointestinal disease. For patients suffering from paucibacillary leprosy, they will have to take 2 antibiotics such as dapsone each day and rifampicin once a month. On the other hand, multibacillary leprosy patients must take a daily dose of the antibiotic clofazimine in addition to the daily dapsone and monthly rifampicin. Multi-therapy is required for 1 to 2 years to achieve effective recovery. Bye, thank you for watching.